Welcome back to another episode of the Modern Patient Experience by Q Squared. I'm your host, James Furbush. My guest this week is John Shufedlt, MD. John is an emergency medicine physician by practice, but he has also started and launched numerous companies within the healthcare space. Most recently, MeMD, which he sold to Walmart, and Tribal MD. John, welcome to the program.
Thanks, James. Welcome to. Happy to be here. Thanks for inviting me.
Yeah, no, it's so great. So the reason I wanted to have you on the program is because for as long as I've known you, going back to my days at Athena Health, the thing that has impressed me most is, I guess, for lack of a better way, it's sort of your entrepreneurial spirit, which I know, that is a topic near and dear to your heart. But I think there's a difference between sort of having an entrepreneurial spirit and then actually acting upon it and actually following through and doing stuff. And so I wanted to kind of talk to you about how you see the role of entrepreneurship being able to impact the patient experience in healthcare. And so I kind of just want to start there. I mean, how, can you go into a little bit of your background and sort of talk about how you got the entrepreneurial, how did you sort of develop the sort of entrepreneurial spirit that you carry into the world?
Thanks. I think I've been an entrepreneur since I was young. I mean, I remember doing all things kids do, mowing lawns, shoveling snow. I had a candle making business and all those things I did. But I always started things where I saw a need or perceived the need. Often I was wrong and looked at ways to solve a problem. And so I would see a problem and say, all right, so for example, in the early 90s, I started these urgent care centers. And at the time, there weren't really many around, if any. And so I thought, practicing emergency medicine, I thought, gosh, these people who come there with these minor things, they shouldn't be in the emergency department. It's cost them way too much money. And frankly, the ED should be for really sick and dying people who are critically ill or injured, which is what I like doing. And so I started these urgent care centers with that goal in mind to offload the ED. And I don't know if it ever really has offloaded the emergency departments. I worked yesterday and we were literally, it was like the Tet Offensive. We were overrun with patients for all the hours I was there, and I'm sure all day long. And it's been kind of nonstop in EDs. However, I can only imagine it would be worse, but for the urgent cares in the area. And I'm in an area now where there's, you can't spit without hitting an urgent care. So I can only imagine what the EDs would look like, but for those urgent cares. So I'd always see a need, think if there's a way to solve it, wait around for a day and think, okay, someone else has got to be doing this, but I can't be the only one who's seen this. And then say, how the hell am I going to try to fix it? And that was, I'd be off to the races.
So, it's interesting. So when you started urgent care, this is back in the early 90s, urgent care was not the sort of same, it wasn't as widely accepted. Right now, it's you expect an urgent care facility. It's almost more surprising when there isn't one close by. But back then, that was that was not common. So can you sort of go into, I'd love to just sort of dive into, how did you really sort of pinpoint the need in the market and then really sort of follow through? Because that initial urgent care facilities that you created, it grew to be a 60 or 55 something location, which is really impressive for back then. And so how did you sort of go from identifying that need to then building that company?
So the challenge was when we first kind of came up with this concept, there weren't any urgent cares in Phoenix. And so when I went to the health plans and said, hey, I got this great idea, it's called urgent care, we're going to do this, they looked at me and said, we never heard of that, we don't know how to contract with you. And when I went to the malpractice carriers, they were like, well, yeah, we can get malpractice, be on a provider basis. I said, well, that's not going to work. These providers are going to be moderately transient. They'll probably work a couple of years and go do their own thing. And so we really had to kind of forge ahead in a couple different areas. They were really untouched. But, for the first one, it was making every mistake in the book, was finding a space, building it out. And I thought a lot like how we move patients to the emergency department. So it looked like an emergency department. It had a portico share where ambulances could drive under, although we didn't take ambulances, cars could drive under it. We really operated like a small emergency department, ran blood tests, did x-rays, what have you. Certainly not to the same extent. But, when it started out, I always laugh. I think our first patient for about the first 2 months was a dog who wandered in. And then all of a sudden it was got to be fall and winter, and the snowbirds came back to Phoenix. And all of a sudden we were busy. And it really took off from there. But it was really just iterating as we went along, making mistakes, solving them, and kept moving. And that process never really stopped. So I did it for 17 years. We grew to 60 centers in seven states, about $100 million in revenue. And we literally iterated along the way where we'd identify a problem, think, okay, how can we solve it? And then work to solve it. We were very early in the EHR world as well. I think we had our first EHR in the very early 2000s, and really worked to streamline that to make it as provider-centric as possible, while at the same time capturing all the data and allowing patients to enter their own data into the medical record. So again, probably a little bit before the time, but it worked very well for us.
Yeah, and so it sounds like the common thread sort of is identifying and solving problems. Is that sort of how you see entrepreneurship at its very fundamental level, or how do you sort of think about entrepreneurship, as it relates to you and sort of your career?
I mean, for me, it's been seeing a problem, again, or a perceived problem, thinking, is there a way to solve this? So, for example, a long time ago, in probably 2013, I started a business called HealthyBid. And HealthyBid was a reverse auction for patients who said, I need a non-emergent surgical procedure. I need my gallbladder out. I need my nose job, or what have you. And they put it out to bid, and surgeons in the area would theoretically bid on it and say, look, I can get you in the surgery center on 3 Tuesdays from now. I'm a board certified X. Here's my credentials. And I linked the patient to the provider. And in my mind, this put the patients in the driver's seat, where providers would come to them. It never took off. I think today it may have, probably would capture some more users, but in 2013 it was just probably a little too early. But again, for me, it was I saw a problem. We wanted to get the power back to the patients, and this way they were in control of who they went to, and they weren't searching for physicians. Physicians were searching for patients and providing them the best care at the most affordable cost. A lot of this was high deductible, or patients who were going to pay cash, and it was cosmetic surgery.
Yeah, that's fascinating. Yeah, you would think a two-sided network that connects patients and I mean, because that's always still a challenge, right? Like if I need an elective surgery or something like that, and I have to go to my health plan and figure out who's in my network and are they high cost or low cost or what that might be. It's still a difficult process to figure out, to go from I need this to a physician who can help me solve that problem. So what did you, it sounds like obviously, so not everything has been a success. Failure has probably played some role in your journey. I'm curious, can you talk about sort of the role that failure has played in sort of your journey and sort of entrepreneurship?
Yeah, this will sound relatively counterintuitive or maybe even stupid, but failure has played a large part of my life, and I always would laugh, and it's not untrue. I grew up failing. And so, for me, failure was just like another day. Like, oh, yeah, okay, I'll do it again this way. So I never really got emotionally attached to the success because I would so often fail. And I think that was important, at least for me as an entrepreneur, because many of the things and many of the paths you take don't go anywhere. And so if you don't pivot, you're stuck. If you see failure as a hard stop, you're stuck. There's an old Chinese proverb I always say, fall down 7, get up 8. And for me, that sort of belief system is integral to entrepreneurship, because you have to be resilient enough to say, I'm going to get the crap beat out of me, I know, and this is going to be, but I'm going to push through. And I always tell people, I'm one of those people, in a fight, you'll have to kill me to get me to stop. Now, there are some times when it's important to know when to stop and, know when you're throwing good money after bad. And I'm sure I've thrown some good money after bad over the years. But I think if there's ever sort of a solution or a vision, I try to iterate my way out of these things. It could be failures, but for either I'm too stupid to quit or resilience. And sometimes it's both.
Yeah. So do you have a process for, I guess, identifying ideas, executing on them, and even maybe also recognizing when something is not going to work? I'm kind of curious about how you sort of go about testing ideas and trying to figure out, is there a need in the market for this? Can I make this work? And then maybe even when you get to that point where you're like, okay, maybe this is not going to work. I'm curious about that.
So yeah, I'll use MeMD as an example. MeMD was a telehealth company I started in 2010, literally 2 weeks after leaving NextCare. And it was one of those, for me, moments where, I came to a realization of, well, a couple of realizations. One, in the summer in Arizona and a lot of the places the urgent cares were located, the patient volume would go way down. And so we had providers sitting around. They were high cost, of course. And I wanted to keep them busy and I wanted to get revenue. So that was fact one. Fact two was much of the world, education and banking, for example, were going to becoming digitized. I thought, well, God, if they can digitize that, maybe we can digitize healthcare. Now, there's already another company, Teladoc, out there doing this pretty much phone only at that point. I'd never heard of Teladoc. And so I started asking people, would you see a provider online? So I always had this mantra, what do you do if you don't have a friend that's a physician? So I would get calls still get calls all the time. Hey, what do you think about this? Can you call in a prescription? And I'd always say, God, what would people do if they didn't have a friend that was a doc? And kind of those three things coalesced, and let's start a virtual health company. Now, again, today, virtual health is, it's like, yeah, of course, duh. It's a given. At the time, health plans weren't compensating for it. A lot of people I talked to were like, no, I would never do that. And it was a lot of kind of hard stops as far as people would say, no, that's not for me. But there was a minority of people, and they were mostly in the 20s and early 30s, would say, yeah, totally. If I didn't have to go to see a physician, if I could do it this way online, count me in. So then we went to a direct-to-consumer model where we went out and sold directly to patients, which was great, but it was slow moving. So then we started selling to health plans and large employers, which worked. And now with COVID, I always say COVID probably pushed the telehealth business ahead probably 3 to 4 years in acceptability. I mean, we're going to get there one way or another, but COVID went from being a nice to have to a must have. And that really accelerated the urgent care, the telemedicine space.
Yeah, I feel like COVID accelerated a lot of things related to healthcare and having to, make drastic changes that, maybe not even drastic changes, but just make changes that were, I think in some ways you could probably justify putting off because it's, these are good to haves versus like need to haves. And I think COVID kind of accelerated that sort of need to have in a lot of ways. So, it's funny to hear, you talk about being on the early cusp of urgent care, which is sort of a really common, delivery model these days, telehealth, early days of that, and now that sort of commonly accepted. I'm kind of curious, how do you see sort of the role of entrepreneurship and that way of thinking? How do you see that impacting the patient experience? Because those two things are like very foundational aspects of the patient experience in healthcare, right? Like being able to go to like a walk-in clinic and get affordable care for minor things. Now being able to just sort of dial up and do a telehealth appointment with, I think I had an earache and I called up, did a telehealth, and it was with a physician in like Alabama, and it's like, it's kind of crazy to think it's like I'm being seen by a doctor, 20 states away from me, and it's not you can take for granted like how amazing that kind of is in some ways as a patient, and so I'd love to just hear you. I mean, how do you think about sort of entrepreneurship and as it impacts the patient experience?
I mean, I think, it's integral to the patient experience in as much as when I look at all the advances, pretty much across everything, but particularly in healthcare, well, really, particularly in everything, all the advances we've made as a society, the vast, vast majority is due to that some goofball with some crazy idea that everybody said, this can never be done, this has been done before, we've never done it this way, we've always done it this way, who just said, I think I've got something here. And it's these small little steps that people take initially, and I always call it standing on the shoulders of giants, where they look at what's been done in the past, and, I think I can see farther over the horizon this time. Let me try this thing. It's never been done before, but I think I may have a way to do it, and they pull it off. And it becomes, again, from this crazy idea to this massive company or to this. But in either way, people learn and iterate as they go. So if it doesn't work this time for their next adventure, for their next entrepreneurial vision and idea, maybe it'll work a little better. So I think for the patient experience, for consumerism in healthcare, entrepreneurial efforts are integral to moving the ball forward.
Yeah, and are there things that you're keeping your eye on right now that are potential? I mean, you don't want to give anything away, give someone their own business idea, but I'm kind of curious. I mean, if for someone, you who seems to be able to keep at least that one eye over the horizon, I'm kind of curious what's catching your eye right now or what's intriguing you.
I mean, so here's what I would work on, if I were out to do it again, and maybe I would focus on two things. One, I'd focus on behavioral health. There's a lot of folks with some significant behavioral health issues. When I started MD, frankly, it was for behavioral health issues because I thought, okay, there's a stigma to seeing behavioral health professionals. Maybe if people could do it from home, they'd be more comfortable doing it. I would try to refer patients in the emergency department to psychiatrists or the behavioral health specialists, and was always just basically no. There was just nobody available. That's why MD started. So I would focus on behavioral health, both inpatient and outpatient. And then I'd really focus on the use of AI. And this is not rocket science, but I mean, AI will be the driving force of a way to disseminate quality healthcare to the masses inexpensively. And so even back in the NextCare days, we didn't have AI, but we were very algorithmic based. If this, we basically use a prediction machine. If this, then that. And we try to predict which patients with which complaints were coming in at which times, and we staff accordingly. But we went so far as to say, look, if you're coming in with this, we're pretty sure you're going to require this, and this test, or maybe no test at all. And so we would build out the electronic medical record for the provider prospectively and say, okay, here's what a good chart looks like for a patient with this complaint. You can erase it all, it's all good. But if it fits, this will save you 5 minutes of charting time. But now if you add AI into it and you have the patient go through an AI algorithm prospectively, now all of a sudden the provider has a pretty reasonable chance of getting the right diagnosis just based on the AI. Then the provider walks in and she says, I see Mr. Jones, you're here for X, Y, Z. Let me ask you a few more questions. And then she goes, wow, you know what? Both the algorithm and I think you probably have X. Here's our plan. And then the AI spits out what the state-of-the-art plan is for patients with whatever disease they both come up with together. So all of a sudden, the patient interaction is shortened, the documentation is shortened and improved, and the provider can move on to the next patient, thereby is acting as a force, AI is acting as a force multiplier to see more patients, but still get the same or better quality. I mean, that's where the system has to go, and that's where it is going. I'll give you an example. I owned a teleradiology company for a number of years. And then I heard this company in Israel that was doing plain film readings for $1 for chest x-rays, long bones. And I thought, gosh, we're charging between $9 and $11 for that same read. I see over the horizon, again, no rocket science, but I see where this is going to go. So I sold the company because I knew that in a short amount of time, plain film radiology and anything digitizable will be done by AI. And that's where we are really heading right now. Which is great, it should be.
Yeah, and I think like the AI in looking at like radiology images is such a perfect example because there's such a huge amount of data that you could feed in to identify, I mean, something like pneumonia or, these things that, a human would kind of look at. There is enough data out there to sort of build those algorithms when it comes to definitely like images, but I would think within like an EMR and these other data sets, there's a lot of data and power in using AI as a tool for clinicians to sort of to do exactly what you said.
Yeah, it's I always use the the black cab example in London. If you're a black cab driver in London, it's about a 3-year preparatory time, and it's thousands of hours of studying to become a black cab driver in London. And they were highly paid, highly respected. They knew everything about the city. And then all of a sudden, poof, the iPhone comes out with mapping. And all of a sudden, everybody can drive a black cab, because with the push of a button, you get on Waze or Google Maps, and you know exactly what the black cab driver knows. And even better, you know the traffic pattern that you should go to, because in real time, it's monitoring traffic patterns, which the black cab drivers can't do. And literally in the blink of an eye, put them out of business. Now, it didn't really put them out of business, but much like cab drivers here with Uber and Lyft, it's a different world right now. And that's really that's where healthcare is going.
Yeah, it's a different game. It's funny. I think, is it like the black cab, the test that they have to take, it's regarded as like one of the hardest tests like on the planet for humans to take. That's really funny. But no, it's a good point. It's a good analogy to draw. So what advice would you give to people, or healthcare professionals working in like larger organizations? Because I think, there is sort of a perception of, like you said, right, where it's the ones who are maybe have a goofy idea or have a different type of dream. We think of that sort of those people kind of going off to kind of do their thing. But do you have advice for people who are working in, say, larger organizations that want to improve the patient experience, whether it's reducing like times in the wait room or things like that? Do you have advice for people in larger organizations how they can take sort of that entrepreneurial mindset, it's a tough word, and apply it to their own organization and their role to sort of improve the experience that they're giving to patients?
So, I do, in the sense that I guess that goes down two pathways. The first pathway is, if you want to go out and do it by yourself, but are working in a large organization, make sure you haven't signed some sort of agreement or contract that anything you develop while working in this organization belongs to the organization. In other words, you own the IP that you do outside of work. Most organizations don't allow you to do that. And so I would be very careful about that and get some guidance beforehand. Then, if on the other hand, you want to move the organization that you're working for into this new area, then I just think it takes persistence and basically putting your head down and being the constant force of change, which can be, you worked at Athena, and you know how big Athena is, and as entrepreneurial as Jonathan Bush was and is, I'm sure even that was staring at that. And so it's hard making these incremental changes at large companies unless you have the blessing of someone from the top. Starting from the bottom is difficult, but it's certainly been done all the time. I've had a lot of companies where somebody suggests, "Hey, John, wouldn't it be cool if?" And then I'm like, "Oh man, that really would be cool. Thanks." And then we work on it together, or they work on it and totally own it.
Yeah, that's awesome. And so I want to just jump back real quick. So you kind of mentioned a couple things that you're keeping an eye on, but I'm kind of curious, where you go. You're someone you're a doctor, you're a lawyer, you have an MBA. Where do you go to find inspiration, for either things that you want to do or just in general? Like where do you go to get inspiration and kind of keep your mind fresh?
So I'm a constant reader / listener. Thank God for Audible, because now I can read while running and read while working out. So thank God for that. So I do spend a lot of time listening and reading the books. I go back to school often. I just really started another program. And so I've already learned some things in that. I'm like, oh, God, that's pretty cool. But I always think of education as putting on a new pair of glasses. And education can just be picking up a book and reading it. But I can't count the number of times I've read something and I thought, God, how did I not know that? That is so damn obvious. And I'm an idiot. How did I not know this? And then it launches me down a path. Maybe the path is a new business. Maybe the path is a new perspective. Viktor Frankl, Man's Search for Meaning, you realize and you read about the challenges Viktor Frankl faced while in a Nazi concentration camp and what he witnessed. And yet he was able to come out of that with this perspective that he had. And I always think, well, God, if he can come out of that horrible, horrible years in that concentration camp where he lost his family and all his friends and all these people he cared for as a physician, and still have that perspective. And with my little challenges in life, I will be damned if I'm going to complain and whine about them. And it's things like that.
Yeah, that's so good. I mean, perspective really is everything. I think I try to remind myself of that like every day, right? It's like because it's so easy sometimes to have that mindset where you just get bogged down and kind of complain. And then, but then you look around, you're like, oh my God, like I'm so fortunate. I have all these like wonderful things and blessings in my life. And sort of keep that perspective is really important.
Well, I'm fortunate that I work in an emergency department and on the reservation sometimes, but in a inner city others. And so, for example, just yesterday, it was a zoo. And every day I walk out of the emergency department, literally, I'm like, thank God. I mean, a lot of these patients, their best day is 100 times worse than my worst day. And knowing that, you think, what literally could I ever complain about? I mean, it's pathetic. And so I try to do my best not to whine and complain about these trivialities that for the folks I take care of and that they honor take care of would be a blessing. And, here I'm complaining about them on, shut up, John. So anyway.
Yeah. Awesome. Well, John, this has been such a good conversation. I want to thank you for making the time to speak with us about kind of the role of entrepreneurship in healthcare and how it can impact the patient experience. And so, thank you for making the time and sharing some insights and stories with us.
Thanks, James. I'm honored to be included, so thank you.
Awesome. All right, John, take care. And until next time, it was a pleasure.
Thanks.